It's 4:30 here in Seoul. I'm Devin Whiting at the Arirang newsroom, bringing you the latest briefing from the South Korean health authorities. That'll begin shortly. We'll be getting the details on the latest cases, as well as the measures the government's taking to stop the spread of COVID-19. We know that today there were another 91 cases reported in South Korea. That's the sixth day in a row there have been fewer than 100. These cases continue to be concentrated in the Seoul area. It's been a week now. They've been under 100. Let's listen into the briefing.
And we also have Jong-gu Kim from the Minister of Culture participating, and we will be providing the sign language translation provided by Kwon Dong-woo. We will first hear from Minister Bang Neung-hoo. Hello, I am the first Vice Head of the Central Disaster and Safety Countermeasures Headquarters, Minister Bang Neung-hoo. As of midnight of today, there were 71 community spread that were newly confirmed. And there were 4 people from the non-metropolitan areas and 67 coming from the metropolitan areas. So 1 person passed away yesterday. We pay our respect to the deceased and we pay our condolences to the family members. Now I will explain about the risk level. Due to the Hangul Day and Chuseok holiday, we were fearful for additional spread. However, until now, we are not seeing a massive outbreak. Since right after the Chuseok holiday and including the Hangul Day, for the past 2 weeks, there were 61.8 newly confirmed cases on a daily average, and compared to 65.5 from the previous 2 weeks, there was a slight decrease. And for the new cluster outbreak, there were 24 cases, and compared to the 29 from the previous 2 weeks, there was a decrease. And also for the cases from the unknown causes, it is decreasing continuously, and right now it is around 16.5%. And we also have enough room for the critical ill cases as well. So we will be able to treat people and manage people and control everything at a level that we can control without needing special treatments. However, there are still risks remaining. Right now, the reinfection rate is still being maintained at a previous level. And right now, the decrease in newly confirmed cases is facing a flat level. And especially for the metropolitan area, we're not fully stabilized. So there has been a decrease in cluster outbreaks. But for vulnerable facilities such as long-term care facilities, there are still cluster outbreaks that are happening in a staggered manner. And because of this, we still have to take caution because otherwise we will see a spread of the infection anywhere at any time. Starting this week, for the long-term care facilities and for those hospitals in metropolitan areas, we're going to have diagnostics done. And we're going to strengthen the measures for the autumn season. So we're taking many efforts in a multi-angular level. To our citizens as well, we ask you to continue to wear face masks and also make sure to wash your hands and follow coughing etiquettes. So we ask you to continue to follow personal guidelines on hygiene. Until we can see the development of vaccine, COVID-19 will be prolonged. And right now, even across the world, COVID-19 is continuing to spread, and there is even an expansion as well. Right now, we have to accept that we have to live together with COVID-19. And therefore, while we control COVID-19 to a level that we can control, we also have to come up with a way to coordinate that with our economies and with our daily lives. So, with the loosening and alleviation of the social distancing measures, it does not mean that we are seeing the numbers from COVID-19 decreasing. It just means that we are trying to find a way to live together with it. Because otherwise, we will see that our citizens will lose happiness. And this can lead to an exacerbation of the despair felt by our normal citizens and small businesses. And that is why we have decided to alleviate the measures. You may feel uncomfortable with the current way of life, and you will additionally hear warnings, and this may cause you to feel fear. However, for the safety of not only ourselves but for those around you, we ask you to be considerate and make sure that you live in coordination with others around you. Right now, we are confident about the power of our citizens, and we are also striving hard so that we can secure happiness of our citizens. So for the businesses that had difficulties until now, we're trying to support them and also to actually activate the economic activities. We prudentially want to distribute some discount coupons for vitalizing the economy. So this is not for all sectors. So this will be applied in a step-by-step manner. So starting from October 22nd, you'll be able to use these coupons in public centers and at the end of October in the movie sectors and starting in November in the sports sectors. So for accommodations, travel, and dine-outs, we are not going to include them in the countermeasures this time or the measures that we're taking this time around. So we're going to review including them later on, depending on the situation. So for facilities in which these coupons will be applied, we're going to make sure that these businesses follow core disease control measures. And for consumers as well, the coupons will only be distributed when they agree to follow the measures as well. So we're also going to have personnel support for monitoring these, and we're going to ensure that disease control is strictly applied. So for these discount coupons on the ways to use and for the dates of implementation, please refer to the press release documents. So for such consumption discount coupons, we hope that this will help small businesses and other businesses as well. And we also hope that this will be helpful for our citizens who probably felt very tired due to the prolonged situation of COVID-19. So we hope that this will be a stream of light to them. We ask the citizens to make sure to follow the guidelines on personal hygiene and disease control, but also participate in these activities so that we can vitalize such small businesses, and we hope that you will feel even a small bit of happiness through this. With the prolonging of COVID-19, Corona blues have been incorporated into our lives, and this is impacting the health of our citizens. So we believe that we have to prevent such corona blues, and in addition to that, in order to prevent other diseases as well, we are also providing consultation services. Through apps and KakaoTalk services, the government is providing self-diagnostic services, and also we are providing a consultation hotline, and we are operating it so that we can provide consultations about COVID-19 blues. And also for people who are confirmed, we are providing a hotline service, consultation service, and we are also linking them to psychological consultations as if necessary. So for people who are feeling corona blues, please make sure that you get help through these services. So COVID and corona blues is a big task that we have to face. And on behalf of the government, I would like to thank everyone who is taking efforts to support this program. So the government will also come up with a more comprehensive and systematic measures to deal with COVID-19 and corona blues. And also for the health of the psychology of our citizens, we're going to continue to come up with additional measures as well. And also through the mental health measures and planning, we're going to come up with new measures so that we can prevent any COVID-19 blues that are coming about. So there is an undermining of the mental health due to COVID-19, and of course it is not easy to resolve everything. However, through the cooperation of our citizens and the government, if all of our citizens were to be considerate and participate in the activities that we are taking, we believe that we will be able to come up with a more mature society. So let us remember that we are a community where we live together, and under that perception, we ask you to take a bit more interest in those around you and be a bit more considerate. So with regards to the disease control, about the construction workers working abroad, I'll tell you about the measures that we are taking. So there are around 9,000 people working in the construction sectors across the world in 92 different countries. And they're supporting the construction of many different areas. And the government is providing services for them. Starting last month, we have come up with a non-face-to-face consultation service. And until now, 125 construction workers abroad have used the non-face-to-face diagnostic services, and we believe that this will be vitalized even more. And also, we are providing the support for face masks and other PPEs, and we are trying to make sure that this is passing the customs of the countries abroad. And we are also coming up with safety measures as well. So previously, we have also seen the workers from Iraq coming back to Korea, and we have supported this return. And for the collective returners, they are actually put into live treatment centers in a separate manner so that they do not spread any infection if they are infected. And also for the overseas construction companies, we are providing legal consulting and explanation sessions. The government will continue to provide interest about the construction workers who are working abroad, and we're going to make sure that we provide the necessary support to our citizens who are working abroad as well. So right now we're at a situation where we have to coexist with COVID-19. And in such a situation, we want to ensure that we recover the economic activities while controlling the disease. And this target is, of course, not an easy target. However, when we see a lot of the cases abroad, we can see how sensitive this is and how fine the line between balances are. However, we have experience of overcoming any crisis until now, and we also have trust for one another. So the government is confident about the power of our citizens, and we are going to strive hard so that we can stabilize the COVID-19 situation. And in a midst of such a condition, we will also make sure to come up with measures so that we can help out our citizens. We also ask our citizens for the following. So, as an agent of disease control, we ask every individual, as you have done until now, to take any creative measures for disease control. Thank you.
지금부터 질의응답 시간을 가지겠습니다.
And that'll conclude our coverage of this briefing. Thank you for watching. Arirang News will be back at 6 p.m. Korea time. Bye for now.